15-year-old Nehemiah Griego has been indicted for killing his parents and 3 siblings. And when the news broke of this mass killing, many of us were left stunned, wondering what could have provoked this boy to murder his family. Well, it was reported that Nehemiah was a fan of violent video games, in particular Call of Duty, Modern Warfare, and Grand Theft Auto. And there was some speculation that perhaps they triggered this violence. But what really is the root of violent tendencies in children? Well, Dr. Christopher Alexander is a child psychologist specializing in psychological disorders in children and joins us this morning with a message to parents about recognizing, diagnosing, and treating emotional and behavioral disorders. Thank you so much for joining us.
Thank you.
This is such an important topic, and I really appreciate you being here today. Let's first address the assertion that video games actually can desensitize the children to violence, and it helps play a role in these mass murderers. I mean, we understand that even the shooters at Columbine, as well as at Newtown, were also fans of violent video games. So what do you say to that?
Well, I know that the Obama administration has asked for more money to look into this, and I think that's a good thing to be exploring, but it's not new territory. We've actually been exploring the idea of, is there a connection between video games, violent or otherwise, and children's behavior for years now, and there really hasn't been a link.
Really?
A few years ago, California had introduced legislation to limit the age that children can purchase video games. And the Supreme Court shot it down because they looked at that research and said there's no research to substantiate that these kids are more likely to engage in violent behaviors than kids who are not watching these.
Do they think that putting the ratings make a difference as well?
That was the intention behind the California initiative, to see if the ratings could put a cap on that. And the Supreme Court said no, it just doesn't hold up.
Wow. Well, so then what is your message to parents out there about the effect of video games on their children, despite what the research has shown?
I don't think that playing a video game is going to lead to violent behavior on the part of a child. I think that it's important for parents to limit the amount of time that kids play video games in general.
Right.
Because in my practice, it's a huge source of contention between the parents in terms of how long they want the kids to play the video games and how long the kids are actually playing them. So I think limits have to be set around it. It's important for parents to know what games the kids are playing and how long they're playing them, and to make sure there's a range of video games that they have access to and they're not just all of a violent quality.
Right, because like we said, it could desensitize them to what violent behavior is really like by seeing so much of that without the diversity of something fun on the other side.
It could.
You know, so I'm curious what you say about this. Was there a common thread that you saw with the teens who committed these kind of high-profile murders? Was there a common thread between them?
There has been a lot of research into this, and what the research shows is that there's 4 major findings.
Okay.
One is that of the kids who are engaged in these violent behaviors, they're all male. Yet 40% of girls are playing video games.
That's a good point. That's a really good point.
The other one is that most of these kids had dealt with some significant loss prior to the crime,
Okay.
like the loss of a pet, parental separation, parental divorce, the loss of a relationship, maybe a friend moved away. The other one is they all were struggling with depression, be it that it was diagnosed or not.
Okay.
And most of them had given clues to other people that they were thinking about doing something of this nature.
Which really indicates how important it is to pay attention when kids say things. You have to look at those clues.
Correct.
All along. So what behavior specifically then would you advise a parent be aware of that might lead them to suspect that even their child could be involved in some sort of criminal behavior, even whether it be shoplifting or something worse than that?
Well, I think it's always important to pay attention to the risk factors. And we know that for any kid who's going to get involved in juvenile crime, there are 3 main risk factors that stand out.
Okay.
One is growing up in a single-parent household.
Okay.
One is being exposed to parental domestic violence, particularly if their mom was being hit or yelled at. And the third one is if they are a victim of abuse or neglect themselves.
Okay.
And that's pretty much what I see in my practice when I do these evaluations of these kids, is that they have one or more of those factors involved in their life, and they're also struggling with some type of mental health issue, whether it was diagnosed or not. That I would say all or the majority of kids in our juvenile justice system are struggling with some pretty significant mental health problems.
It's scary to think about, but these are the signs we need to look for. Now, once we've discovered these signs and we see these kind of problems, how do you actually treat the children who do things like committing, whether it be petty or serious crimes?
Well, it usually requires a multidisciplinary approach.
Okay.
That I think it's a combination of individual counseling for the kid to see if there's issues that they're dealing with, but there has to be some type of family counseling involved.
Okay.
That you have to work systemically in terms of trying to bring in the other people in that child's world so that you have a unified approach to dealing with it.
Right.
it's important to treat the underlying mental health condition that the child might be dealing with. And that could be depression, anxiety, some type of behavior disorder, a learning disorder, a neurocognitive impairment. And treating those kinds of issues, the kid may require specialized forms of mental health treatment, such as medication or specialized programming. But there's no single approach that's going to work at addressing it.
Okay, so you really have to get to the root of the problem, and each problem is going to be different depending on the child. So let me ask you this before you go. Could somebody like Nehemiah, or children who have been through these kind of violent crimes, could somebody like him be rehabilitated?
Well, I think the thing we pay attention to in terms of rehabilitation is the child's capacity for empathy.
Okay.
Whether or not they have compassion for other people and can recognize the impact that their crime had on others. And it's a difficult area because when you take a look at surveys with parents, 90% of them think that empathy can be taught. Yet when you take a look at the clinical research, it's much lower.
Okay.
That it's really difficult to teach empathy to someone who doesn't show signs of it, especially when they're older.
Okay.
And again, I think in terms of rehabilitation, there has to be the family support.
Definitely.
That if you have a child that has a medical problem or a mental health problem, there are books, there are pamphlets, there are resources, there are programs. But if you have a parent whose child committed a crime, there's nothing for them.
Okay.
And so these families experience a great deal of isolation, which at times can interfere with them being available for the child who is struggling or who might now be part of the juvenile justice system.
Well, it's such valuable information that you have, and so many people out there could use it. I know we could go the whole hour talking about this, but if people want to get more information than what they heard today, how can they find you?
I would just go through my website.
Okay.
It's alexanderphd.com.
Okay, and they can
And all
get
my
more
contact
details.
information is there.
Fantastic. Thank you so much.
All
We
right.
appreciate you being here today,
All
and
right.
thank you, and we wish well to all the people that are struggling out there, and we'll be right back.